When we think about a broken bone, most of us picture a cast, maybe some crutches, and a few weeks of just taking it easy. But what happens when the injury is way more than that? We're going to go beyond a simple fracture and dive into the complex, high-stakes world of severe bone trauma and the incredible science that puts it all back together.
And that's really the question, isn't it? We're not talking about a little crack you get from falling off your bike. We're talking about a bone that shatters, a bone that actually breaks through the skin, opening a direct gateway for a whole cascade of really, really bad complications. In these cases, the break itself, that's just the first domino to fall. I mean, just look at this image. This is a bone dealing with something called chronic osteomyelitis, a deep, nasty, long-term infection. See how swollen and warped it is? That is the kind of thing that can happen when a bad break takes a really bad turn.
Okay, so let's start this journey right at the beginning. The moment of injury. The moment a normal fracture becomes something way, way more dangerous.
This is where our story kicks off, with what's called a compound, or an open, fracture. And just like it says, the bone is now exposed to the outside world. Now think about that for a sec. The sterile, protected environment inside your body is suddenly open to dirt, bacteria, everything. The clock is officially ticking.
What's really fascinating is how surgeons assess the damage right away. They use this system, the Gustilo classification. A type 1, that's like a small, clean puncture. But as you go down the list, things get bad fast. By the time you hit a type 3C, you're looking at a catastrophe, massive tissue damage, and a torn artery. At that point, surgeons aren't just fixing a bone. They're in a flat-out race against time to save the entire limb.
And the response has to be just as intense. This is not just putting on a splint. We're talking a full-on, multi-step emergency protocol. It starts with resuscitation, controlling any life-threatening bleeding. But look at steps 4, 5, and 6. Decontamination, tetanus shot, and antibiotics. The battle against infection begins the second that patient comes through the door.
But here's the thing. The danger isn't just coming from the outside. The body's own reaction to the trauma can create this hidden and honestly terrifying emergency inside the limb itself.
And this hidden danger has a name: compartment syndrome. Imagine the muscles in your leg are bundled into these tight packages, right? And they're wrapped in this tough tissue that doesn't really stretch. Well, after a huge injury, that tight little package starts filling up with blood and fluid from swelling, and the pressure inside just starts to skyrocket. And this diagram shows the vicious feedback loop that kicks in. It's awful. The injury causes swelling. The swelling increases the pressure. That pressure starts squeezing off the blood supply. So the muscles and nerves, they start to starve for oxygen, which injures them,